Hello everyone, I'm Dr. Abdulaziz Hazazi, consultant of pain medicine. Let's talk about commonly missed causes of back pain. As you know, low back pain is the fifth most common reason for all physician visit, and it is the second most common symptomatic reason after upper respiratory tract infection. About 50 to 80% of adults experience low back pain. Low back pain is the leading cause of disability and lost production in the United States, with associated direct and indirect cost about or more than $50 billion per year. Despite the widespread opinion regarding the resolution of pain after 6 weeks, the pain may persist up to 72%, and disability in up to 12% of patients may persist. On the top of the list, myofascial pain syndrome. On one study conducted by spine surgeons, finding its prevalence to be almost 20% coming after the herniated disc. Myofascial back pain often present as deep achy pain that is aggravated by activity and position change. It may be localized to the low back pain or radiate sometime to the lower limb according to the muscle affected. On the physical examination, usually these patients have a tender taut band of muscle may be noted, what's called a trigger point. When trigger point is appreciated, deep traverse numbing palpation or needle insertion often elicit the characteristic local twitch response. The treatment of these cases usually or mainly conservative, and when trigger point are identified, trigger point injection with local anesthetic alone can be helpful. As well, Botox can help some of these cases. Discogenic pain or degenerative disc disease, or what called internal disc disruption. This patient having changes in the disc itself with the time. Usually they lose the proteoglycans and chondroitin, which are molecules that attach and retain water to keep the disc elastic. And with time, the losing this material translated to a comprehensive strength, a compressive loss of the compression strength of the disc, and the decrease in water itself replaced by collagen, which make the disc more stiff and less compliant under pressure and more susceptible to tear. With significant loss of the water with age, increase in age, the disc is likely to be herniated, but disc space is reduced, and that cause narrowing of the foramen through which nerve root exists. Can produce back pain without radiation, and can be radicular as well. MRI show usually a zone of high intensity. According to many studies, these changes or finding in MRI, like any disc disease, it is not very specific, and high percentage of this patient usually asymptomatic, although there is finding in MRI. Discogenic pain can present, as we mentioned, with back pain radiating into the buttock, hip, groin, or even lower limb, and usually typically worsened by prolonged sitting. Often this pain mimic herniated disc, and it's sometimes difficult to discriminate between herniated disc and discogenic pain. However, there should be an absence of focal neurological finding, which usually present with discogenic pain, and there is no dermatomal radiation as in discogenic, as in herniated disc. One more group to pay attention and not to neglect or ignore during your evaluation to patient with back pain is the visceral causes of back pain. Back pain is the single presenting symptom of some of the medical condition. It is important that the clinician identify the cause and provide the necessary treatment. Managing just with analgesic is not proved to be a good practice. Examination of the abdomen with palpation of the visceral organ is necessary step of diagnosis. Some of the differential diagnoses that can cause back pain, like prostatitis, pyelonephritis, urinary tract infection, aortic aneurysm, acute pancreatitis, duodenal ulcers, cholecystitis, nephrolithiasis, and visceral cancer, and sometimes like inflammatory bowel disease and diverticulitis can cause as well. Visceral pain may be referred to the low back pain, and cause pain, and account for less than 22% of back pain cases. Perturitis syndrome or lumbosacral transitional vertebra, it's an uncommon cause of low back pain, particularly focused along the waistline, slightly off to the side, often diagnosed or confused with sacroiliitis. This diagnosis affects less than 10% of the population, and because of this reason, it often goes underdiagnosed or undiagnosed totally. Transitional vertebral changes that happen usually in enlargement of the transverse process and causing a fake joint which usually touch the pelvis. This fake joint between this enlarged transverse process and the sacrum, if it inflamed, can cause low back pain. And pain is often very similar to pain radiated to sacroiliac pain or even lumbar facet pain. The patient diagnosed with this syndrome often do not experience any symptoms. However, for patients that do, they typically experience low back pain that radiates from the side of their waistline. It is important to rule out other causes that we mentioned earlier, like facet joint, sacroiliac joint, and degenerative disc disease. The first approach for treatment is by physical therapy. If not helping, other option includes steroid injection, radiofrequency ablation, regenerative treatment such as prolotherapy and platelet-rich plasma. For some cases, surgical intervention may be necessary. Clonial nerve entrapment, the incidence of superior clonial nerve entrapment in patients with low back pain was unexpectedly high in one study, about 14%. The incidence of bilateral superior clonial nerve entrapment was 20% and 33% in Japanese studies. Female affected more than male. The true incidence of middle clonial nerve entrapment is still unknown. Low back pain due to this entrapment exacerbated by lumbar movements such as extension, bending, rotation, and prolonged standing. It produced leg symptom in 47 to 84% of patients and mimic radiculopathy due to lumbar disorder. That's why it is not easy to diagnose. Back pain due to medial clonial nerve entrapment is affected by lumbar movement. In 82% of patients, it elicited leg symptoms and was aggravated by short and long period of standing, lumbar flexion, rolling, and prolonged sitting, and by walking as well. As treatment option, we have the block therapy by injecting the site of trigger point, or sometimes the surgical option, rarely needed as release of the entrapment may be necessary. Another thing is Bastrop disease, which is called kissing spine disease. It's a relatively common disorder of the vertebral column, usually happen or commonly seen after between L4 and 5. Usually there is chronic contact between spinous process that may induce osseous hypertrophy. The pain is described as midline in the lumbar region and with radiation along the spine but not laterally. Symptoms are relieved with spinal flexion and aggravated by extension, and the pain can be elicited clinically by palpation of the affected interspinous space. Usually they may have secondary canal stenosis, which usually cause weakness and leg pain, described with standing and walking. Diagnosis dependent upon characteristic finding on the imaging studies, and because of it's not easy diagnosed, usually undertreated, and treatment usually involve percutaneous corticosteroid injection, which shown to be beneficial for symptom relief. Degenerative joint disease of the hip is most often caused by arthritis, such as condition cause ipsilateral groin and medial joint pain. Sometimes pain may radiate to the knee or confused with other radiating from the back. The pain from the hip can be easily distinguished from the lumbar radiculopathy, as the latter does not affect the range of motion of the joint. Various tests of the osteonecrosis of the head of femur, osteoarthritis of the hip shall be positive in case of the degenerative joint disease of the hip. Bursitis, like trochanteric bursitis and ischiogluteal bursitis, are type of pelvic pain that sometimes misdiagnosed as herniated disc or sciatica from the lumbosacral region. The most commonly encountered in the elderly population, and the symptom of the bursitis are pain in the hip region with tenderness and increase in pain with activity. With ischiogluteal bursitis, the pain is localized deep in the center of the buttock, which is aggravated by sitting or walking, and accompanied by radicular pain, which is not relieved by rest usually. The treatment is conservative, involving rest, anti-inflammatory medication, physical therapy, corticosteroid injection, and sometimes may need persectomy. Piriformis syndrome, I will not spend time on this case because my colleague Dr. Husni will talk in detail about piriformis syndrome as a cause of low back pain. Fibromyalgia, it's very important to know and differentiate fibromyalgia from other causes of back pain. And this syndrome usually characterized by widespread musculoskeletal pain, fatigue, and tenderness to tactile pressure, generalized fatigue, and sleep disturbance, as well may associated with other like chronic headache, depression, IBS, and other symptoms affecting the cognitive function and physical fitness. In physical examination, there is no abnormality usually found. That's all, and thank you very much.